Hey, welcome everyone. So, I'm not sure whether to say huddle together or enjoy the room that you have. But
we don't bite, so in case you want to move forward, you can do that. We'll try not to bite. This guy may, but.
Yeah, Mohit may not bite, but you never
I'm
know,
hungry.
Gary. Is that what you're saying? So, glad to have you all. Today we're going to talk about some of the work that we're doing in Elevance Health with our partners in AWS and Deloitte. And we're here just to share a snippet of all the things that we're doing. And I'm particularly grateful. My name's Geeta Wilson. I oversee our whole health advocacy, our service areas, our clinical areas, our DM, so utilization management, DM, sorry, I'm used to using acronyms, and our care management areas. What's unique about our teams is that we are made up of product teams and engineering teams. And so that's about just under 2,500 people who are effectively working these applications and systems, looking at what we want to do for the future. And I want to give a shout out to my colleagues and peers who are here, Matt Penwell and Nisha, and who I see from our Elevance Health and my team over here. Appreciate all of you joining because what you'll see is we're a composite group of respective players who come together. So if I work on something in clinical, Matt over here will work on Sydney application, ensure that we have it represented. So we're ensuring that the front and the back are all speaking to each other. And today is a little bit of excitement that I have because I've been at this thing in healthcare for about 15 years. And we have technologies in play today that help us to move forward faster and with the level of personalization that we need. So I'm going to take a little step back for a minute. Think about the greatest consumer experience that you've had. Whether it's a customer service event, and just hold that thought. What was it like? How were you received? How were you treated? Did somebody approach you and anticipate your needs? Did you have to share everything, or did they fill in the blanks? Did you have to cover your tracks and ensure that you had every I dotted and every T crossed? Who's willing to share that they had a great customer experience? Put your hands up if you've had a great customer experience. Who's willing to share whether they've been in health insurance? So the challenges, and I've worked in many different industries. Before Elevance Health, I was with Humana as well, and I was also with other industries like NCR. And that was back in 2008, so that's like 15 years ago coming up. And we worked in industries, worked in a lot of industries, worked in hospitality, travel, retail. And retail was different to what we have right now. I'm going to take a step back a little bit and look at some of these industries in connection to healthcare. So Katie meets her. She's 63. She's a grandmother of 2. She loves hiking, and she loves her grandchildren. She also is, unfortunately, following a tendon tear. So she knows that she's got an issue, and the doctors determined that she's going to need surgery. So she's anxious. She's a little bit unsure about what's going to take place. And she's also a little bit frustrated because she's not sure how to go forward. What's paid for, what's not paid for, what's covered, what's not covered, who's going to cover her, who's not going to cover her. And while she's going through this thinking, she gets a call from our clinical area asking if she wants to join a program. Hold that. So I think that's interesting because we have to ensure, if we're like other industries, we have to ensure we're meeting consumers, healthcare members where they're at. And right now, Katie's feeling a little anxious. She's getting the news. She's terrified. There's like a spectrum of emotions that she's feeling. She's concerned. Will she be able to walk as she did before? Is she going to be able to cover the costs? Does she have to postpone a vacation to cover the cost of her surgery? Does she like talking to health insurance people? No. So I'm still trying to elevate the consumer experience here as we journey through hers, right? She's also relieved as she's undergoing the surgery. She goes through it, and she's overwhelmed at the same time because she's not sure how she's going to manage her day-to-day tasks. She's not sure how she's going to run a little bit faster with the grandchildren again. And you could even argue that maybe she's in a little bit of a panic state in terms of making sense of her medication. So post-surgery, she arrives at home, she's tired, she's a little cautious, wants some rest, and is surprised when our clinicians outreach to her. And our clinicians have the greatest intentions to be the healthcare partner for life. What does Katie feel right now? Is that really good timing for us to connect with her? Maybe the clinician has an understanding of her background and what she's just gone through, or maybe they don't. And maybe she really hasn't got time to really think about this right now. So sometimes it's easier in healthcare for our consumers to not think about it, to avoid it, until they absolutely need to deal with it. Any of you been here? Kind of, sort of. You know, I talked to you about a little bit of the industries that I've been in. You see, in the last 15 years, we've seen a digital shift that's happened and accelerated other industries. So I used to be in the supporting finance industries, and we're helping in self-service. Remember when you used to have to go to the bank and have to deposit a check? Remember when you had to go and wait in line to understand what your transactions were, whether they're hitting or not? Before you had the phone, you were expecting to do a lot of things, either going to see a teller, or you were expecting to not know until you got your bank statement in through paper. Things changed in the finance industry. We accelerated. When I was at NCI, I worked with the finance industry. We worked with JP Morgan and Chase, and we released at the time, a scalable deposit module. You probably don't even know what that means, but it was an ability for us to deposit checks at the ATM without going into the bricks and mortars. Look at where we are today now. You can deposit a check without going anywhere. You can just take a pic and there you go. We've worked with, how many of you fly Delta? Do you remember when you go to the gate? You're not sure what gate, you're not sure when you're going to land, you're not sure if the flight is early or if it's there on time. You're not sure of a load of things. And there's a lot of regulation. And look at the industry today. Look at how it's moved. I love it. I can go and get an ice cream and know that I have 2 minutes to boarding because I've just been notified that my plane is here. It's given me a play-by-play commentary around my experience that in the industry wasn't there just a few while. And then look at retail. Now you talk and you find products coming up on your phone or coming up on your social media. You hadn't even asked for it. Now, some can say that's a little bit aggressive, right? But the point is that industry is moving, all other industries are moving, and our consumers are saying, 96% of our consumers are saying, healthcare hasn't moved as fast as other industries in the experience. And then you're seeing more and more, about 60% of consumers saying, why can't we know how we know retail? Now clearly, we're in the compassion business, we're in the tender business. You know that there's an array of emotions. We're not buying a phone, consumers aren't buying a phone, but they need to have some sort of understanding from us as their partners. Say that we get them, we understand who they are, we understand what they're going through. And so sometimes what happens is we have individuals who wait to the last minute or until an emergent event occurs. You have delayed clinical interventions. You have health engagement that is not as strong, right? And you have less follow-through, meaning that folks will adhere, maybe they won't adhere to their care plan. So we have a lot of disparity in healthcare, and then on top of that, you continue to add the ascending costs that we experience. A few years ago, we were looking at 3 million. Now we're looking, 3 trillion, sorry. Now we're looking at nearly 7 trillion by 2030. How can we at least sustain that? We can't. So here's the truth of the matter. I have a portfolio between service applications and clinical applications and provider applications, and they have IVR. They have like a desktop, what we call CRM, right? They have like different workflow that funnels through them all. And we have to think, how do I make it so that they're orchestrated? How do I make it so when a service agent is talking, they can see what interactions they've had with a clinician or a provider? How can I do that? How can I ensure that as the clinician is having a conversation, that they're actually talking to someone who's going to engage with them at the right time? And so they're there willingly versus feeling like, why are you calling me? And why am I here on this phone call with you? It doesn't make sense. Instead, what we can do is try and orchestrate it so that these communications make sense. These interactions make sense. So that when folks are reaching out, it's at a time that makes sense to them. It's also very close to demonstrating empathy. We really are in a tender business. If you think about it, some folks are in the most vulnerable moments when they interact with us. And when I have, sometimes people think technologists and machines are like the same. They're not. But our technologists have to think about how do we intercept compassion as we're interacting with individuals. And that means serving up things to clinicians maybe that they don't have to hunt for, or agents or service agents don't have to hunt for. We can serve that information as the conversation is taking place. Or if there is a conversation that's taking place from a consumer and they want to talk to us, they get through to the right person and they have that information at their fingertips. And that is about orchestrating that personalization. Now, I didn't start off with telling you about Elevance Health and what business we're in, because I felt like it was important for you to have the context of what we're trying to address as a company. And the real challenge is, while they seem broader, we're going to bring it right close down to some use cases that we're utilizing and making sure that these experiences have some of that orchestration. So if you're not sure, we're about 120 million consumers we serve between our behavioral health, our medical, our pharmacy areas. And we have about 100,000 associates. About 30,000 of them are between our agents, service agents and clinicians, and in our provider world. So I have to figure out how to make their world easier to interact with their members. All at the same time, trying to deliver on our whole health message and ensure that folks engage in their health in a way that makes sense to them and not to us. It's almost like a win-win. Think about it for a minute. Like, is it really our intention that you get sick? No. Is it our intention that you get better? Yes. Sometimes that doesn't always come through when they interact with us, because sometimes they hear claims are denied or a prior authorization is denied. And they're not sure why, and we make it hard. And so that's the orchestration between understanding what benefits you have, getting them through the passage, and then having them approved, or having the understanding, but making that all that clinical administrative work like rote and routine, so that we can actually have engaging conversations with individuals that allows them to think that, okay, you want to help me at this particular time. And that's where our digital health platform is going to play a role. You're going to hear about some of these technologies that we've had. You've seen other industries accelerate and do that. Healthcare is doing that. We're doing that at Elevance Health. Trying to put the member first and what I call a connected experience. So have all of these individual areas that traditionally may have worked independently of each other in a fragmented fashion. Like the consumer doesn't care if Jill from service is talking, or if Jane from the clinician area or nurse is talking to them and doesn't have the information and the systems are different. They don't care. They care that you're meeting them at their level of need. And I think that's our opportunity, is to say, how do we blend the orchestration of services with a little bit, I think in healthcare that's needed is called personalization, or I like to call it humanization. And that sounds really like a good buzzword, but we'll share with you how we're changing that with some of the technologies. Just to look at the use case a little bit from our care management perspective. We traditionally say, okay, we'll address like the most sickest population. that's great. And the level of effort needed is manual, so we'll clinically outreach by telephone to individuals and converse with them. If I flipped that and said, what if we digitize a lot of the work that they do to make it easier, to make it dynamically guided, and we expand our outreach so we actually meet more than just the 10% sick, but the rising, right? The rising population that is needing our help but doesn't even know it yet, and we anticipate that. And that's the opportunity. We leave about, right now the cost of serving is just under $1,000 per member per month. And so you think about that and you think, well, how do I reduce that, take away the administrative costs, and still increase engagement with about 5 more times members? To do that, we have to think about how we engage from I call it precision engagement. So I know who you are, potentially, you've given me that permission, or with the level of permission that you've given me, you show that I've tried to meet you where you're at, and I make it easier to interact with us at a human level. Then I have an ambient intelligent hub, which allows me to take the important information about yourself, about your health condition, about who you are as a person, and intercept with the need that we have. How do I do that? Take a simple example like a care plan. People have to do a health assessment on there. If I take a care plan, as that conversation is taking place with the member, I use voice transcription to then actually automate the guided workflow to fill out the forms. So there's no after-call work, and Gary and Mohit will talk a little bit about that. And then operational intelligence is, sometimes there's a lot of work preparing for an outreach. There's a lot of work while the conversation is taking place, and then after the conversation takes place. If I say in a use case, how do we increase operational intelligence so that we're having knowledge intercepted as the conversation is happening, and guided workflow that's being done as the conversation is taking place. So these are opportunities where we triangulate between engagement, operations, and ambient intelligence. I'm going to introduce Mohit. He's a teammate that works together with us on some of these technologies and how we're orchestrating it.
Great. Well, good afternoon, everyone. Mohit Jain. Really nice to be here. So Geeta presented a really good perspective on the opportunity we have in the industry to really transform experiences for Katie, for millions of people like Katie, for all of us, for you, and for me. So I'm going to start today by sharing a little bit about why I am so excited to be working with Elevance Health and with AWS to really transform these experiences and create the next generation of experiences in healthcare. Just by way of background, I've been working in the healthcare industry for 16 years, and I've spent these 16 years really innovating, bringing technologies like AWS into healthcare operations to transform it. I've had the privilege to work on some really complex problems like provider management, which really are the systems that are set up to enable payers like Elevance Health to pay for your cost of care. I've had the opportunity to work on clinical engagement on claims management system. But at the core of all of this is really helping payers like Elevance Health and their teams of clinicians, nurses, doctors who are set up and who spend their entire day focused on improving the health of the members. What I've found out in these 16 years is despite all of these, healthcare is still complex. This sums up, right, an experience that we all have. How many of you have been to a doctor, come back home, a few weeks later, gotten a letter in the mail with a bill that makes no sense? I know I have. And the length seems funny, but this is real. Here is an actual hospital bill that we got after our son Nirvan was born. You can't tell over here, but this is a 8.5 by 14 paper, 8.5 inches by 14 feet. That's twice as high as I am. Think about that. So my wife comes to me with this letter, gives it to me, and says, "You've been transforming healthcare for over a decade. Explain this to me." You should see the smirk on her face when I was sitting perplexed trying to figure out what this thing is. But that's the reality of our kind of healthcare system. That's the time of crummy experiences we all go through. Now, in order to figure some of this out, I made a phone call to my insurance company. It wasn't Elevance Health. But I made the phone call. I had to make 3 different phone calls over a period of 1 week. I got transferred to 6 different people, and at the end of the day, still did not understand what was in this bill. But that's what excites me. We are taking experiences like this to transform these experiences for healthcare members and healthcare consumers working with Elevance and AWS. Over the last decade, as Geeta mentioned, there's a lot of technology innovation, and there is some technology innovation in healthcare as well. We have built some amazing systems, but they don't talk to each other. We have collected a lot of data and created actionable insights, but we don't know how to send those insights to our members. We have really amazing next best health actions, but we don't know how to motivate our members to use those actions to improve their health, and that's what we are transforming. With Elevance Health and AWS, we are creating the next generation of intelligent clinical experiences. We are connecting those disparate systems so that we can create common experiences and connected experiences. Using ambient intelligence, we are understanding our consumers' needs. We are being proactive and predictive in what they may need and reach out to them before even they know that they need help. With intelligent engagement, we are trying to understand what our consumers need, understand their preferences, their health needs and outcomes, and intervene at the right time, on the right day, with the right message, so that they can have the maximum health outcome. We truly currently live in a provide transactional-based experiences, but we are going deeper and wider to create intelligence-based experiences. And this is what will change the industry in the future. How are we doing this? In the past, over the last decade or so, as I mentioned, health insurance companies and other kind of the health industry has been collecting data and really been focused on the data science side. Collecting data, creating insights, and understanding insights, actionable insights from the data. But we are combining that with behavioral science, the art of understanding how to motivate someone, the art of understanding how to change behavior and nudge people towards making the right health decisions. Combining those 2 things really allows us to make a change. But that doesn't happen today. Imagine this. You guys all, for folks who use Netflix or YouTube, you finish a video and you get suggestions, right? Recommendations on what you should watch. Imagine if there were those amazing recommendations, but you never get them. That's kind of what happens when you have only data science. But we've been able to combine data science and behavioral science to change experiences. There are 3 building blocks. We will get into the technology details in just a second, but 3 building blocks. The insights on the left-hand side, which is continuously learning and understanding what's happening with the member. In the middle is really where the behavioral science magic happens, creating content that is personalized and customized in real time to the individual. Figuring out what are the ingredients, your preferences, the ingredients of the content that you want to consume, and being able to create that content in real time when we are ready to engage. And on the right-hand side are the delivery channels, the omni-channel capability that not just sends and receives messages, but actually is listening for and figuring out what do you like, what do you not like, what time did you respond to the message. If I send you a text, if I send you a chat, do you respond in the morning or the evening? Do you respond on a Monday or a Saturday? And learning from that experience so that I can engage with you at the right time. These experiences will change healthcare, and our hope is that we can make healthcare addicting. If we can do that, we will improve health outcomes, and we will reduce the cost of healthcare in the US. I'll turn it over to Gary to tell you how he makes it real.
All right, let's bring it to life with AWS. My name is Gary Arora. I'm a chief architect with Deloitte, and these are the kind of solutions I build for a living. Let me start by asking a rhetorical question. Can we even have a reInvent session without an architecture diagram? So this is it. This is the reason why I'm on the stage. Thank you. This is our architecture diagram. We have a lot of services here. At the center, you'll notice we have Amazon Connect, and then you have all the roads that are leading to and from Amazon Connect. So there are a bunch of things going on here. Let me simplify this. We can group our services into three categories of capabilities. One is omni-channel engagement, second is intelligence, and the third is personalization. So for omni-channel engagement, we use services such as Comprehend, SNS, Pinpoint. For intelligence, we use Contact Lens that comes with Amazon Connect. And for personalization, we use SageMaker and other AI ML tools that we have, right? Now, every single icon here, every single service here is extremely intentional, right? We have picked this for a very specific reason. And that reason has been grounded in our guiding principles. So these are our guiding principles. We have 8 of them. I'm going to just pick on 3. So the first one, top left, is the cloud managed infrastructure. We made a conscious decision to not be in the business of managing infrastructure. Now, as much fun as managing infrastructure is, we just wanted to focus our energies and time and money into building features, right? That's why majority of our architecture is serverless. It's using serverless components, right? So it allows us to free up the capacity of time and resource that we can deviate and devote towards feature building. Second, top left, leverage native ecosystem. What that really means is AWS technologies, the different services and the components that exist within the AWS platform, they are first-class citizens, which means if there is any capability we want to develop, we first look at whether it's possible through a native AWS service, and if it is, then we would rather use that than going elsewhere. And this helps us for it brings a couple of insights. One is that it rationalizes our tech stack, right? It rationalizes our skill set as well, in terms of lowering the cost of maintenance, right? And ramping up resources for maintaining the solution. Speaking of cost, let me direct your attention to top right, usage-based payment model. The shift from always on license-based infrastructure and product to pay when you use it and only when you use it allows us to, again, reduce our cost by up to 50 to 60%. And those savings can, again, be devoted towards new feature development and capabilities, right? So this is the basis of how we came up with this architecture and how we picked those services, because there are multiple options for pretty much each of those capabilities, right? But this is the reason we built our solution this way. So what's possible now? Now that we have this solution in place, now that we have these foundational capabilities in place, what are the new experiences we can enable for Katie and millions like her, right? Now, there are a ton of those experiences. What we have done here is just curated 4 of them, and I'm going to walk you through each of these now. So first is personalized engagement, right? So this is going back to Katie's example. This is an outreach that we have for Katie before she begins her surgery, right? So this is just when she receives the news. She's been asked if she has all the information she needs, if she needs help with any appointments, right? And here we are able to help her find a surgeon. We are able to help her pick a time of her choosing. And then we go beyond that. We are also able to find if she needs help getting to that place, and we are able to book her a cab as well, because these integrations are possible. Again, going back to our guiding principles, we have APIs and microservices and extensibility that allow us to create a solution like this. Now let me point something here that's not as noticeable. This is not just a bot-based interaction. We are constantly learning. We are looking for what days in a week Katie is most responsive to our text messages. What times during the day Katie is most responsive to our text messages. We are taking that information, we are learning that about Katie, so that next time we reach her, we are reaching her in her desired time, in her desired day of the week, right? So this is a constant learning platform that is just trying to get better and better, be more personalized towards Katie, right? So that's personalized engagement. Okay, for those of us who are married, or have been married for a while, or have been in relationships for a while, tell me if you know the difference between, I'm fine, I'm fine. There's a difference, isn't it? I'm still trying to figure out. But the inflection, the emphasis, right, that conveys a lot more than words. And words don't often tell the full story, right? And when you don't see your customers face to face, when you're only interacting with them through a screen or on audio, and you can't see them, if you don't realize how they're feeling, if you don't get their emotions, how are you going to meet their needs, right? So we have a solution called True Voice. It's an in-house product that Deloitte has built. It works on top of Amazon Connect. It's an all-in-one voice analytics solution. And what it really does is it's constantly listening to the conversations, and it's analyzing for behavior and emotion. And it's then giving a score. So bottom right, you have interaction at an agent and a member level. So it can tell how the conversation is going from a sentiment analysis perspective. What were the positives? What were the negatives? What were the empty spaces? That information can then be used to coach the agent to get better, right? Then we go into the agent performance. We can compare the agent across the whole spectrum of other agents. What's their performance? What are the kind of questions they're asking? How are the conversations going? And then we get the overall outcomes in terms of the member satisfaction, just the tone of the conversation, the emotional and the behavior nuances that you would miss if it was plain text-based interaction. So that's voice analytics. Any solution that is devoid of being integrated with existing CRM is just not being realistic, right? And that's often a common trap. You build solutions that are so greenfield, but they don't have the bridge with the existing technologies in place. So this solution that we have built has been intentionally integrated and designed to be integrated with the CRMs in place. And what that allows us to do is things like we can have web-based chat directly off the existing platforms, right? And from that web-based chat with a bot, you can then get transferred to a real agent or clinician and be speaking or conversing in your preferred language of choice, because we can get that information from the CRM for that member, right? We can personalize the member engagement, and we can empower the agent. So to the agent, we can provide a 360 view of the member. So they know who they're talking to, what is the context, what is the shared history, what are their concerns, what are their preferences. And that allows you to tailor that experience for that agent, okay? We have the case transcription as well. So for every conversation that's happening, you have auto transcription. That's a really important feature, because usually agents and clinicians would spend a lot of time converting manual notes into intelligent snippets, right? So all of these things are now automated. The goal here is simple. We want to shift clinicians from admin task to more health outcome-driven task. And that takes me to the capability number 4 that I want to highlight, which is Ambient Intelligence Hub. This is the one I'm most excited about. This has a lot of promise, right? And this is, we're just beginning to scratch the surface of Ambient Intelligence Hub. So the idea here is we want to empower clinicians to personalize member engagement. And the problem that we are trying to solve is that clinicians today, they spend valuable time in preparing for a case before they even talk to a member, right? And when they do talk to a member, while the conversation is happening, they have to look up information about the member, things that may be pertinent to the member. That increases the hold time, right? That increases the silence conversation during the engagement. That's one problem we're trying to solve. And then post-call work that you have to do, right? In terms of taking the notes and any action items, any follow-ups, you have to then think about that and then put that in the system. That takes a lot of time, and that's a lot of admin headache as well. There's like overhead that's involved. And those are the things we want to automate so that the clinician can only be focused on having meaningful conversations with the member. So what I'll show to you is a sneak preview of what this looks like in action. There's a demo here that shows how a conversation might happen between a member and a clinician. And see if you can notice any of the capabilities we mentioned from the previous slide in this one. All right, here we go.
Hello, this is Tony. I'm a clinician from Elevance Health. This call may be recorded for quality assurance. Am I speaking to Chris?
Hi, Tony. Yes, this is Chris.
Great. Our records indicate that you recently had knee surgery. How did your procedure go?
Yes, I had knee surgery last week. The procedure went well. I was discharged a couple of days ago.
That's fantastic. An important step in your recovery is taking your medication and sticking with your physical therapy. Your health plan actually comes with extra help to assist you in your recovery, including a personal care manager at no extra cost to you.
Okay, that sounds great.
As part of your benefits, you're eligible to enroll in our Post-Discharge Management Program, or PDM for short. Would you like to know more?
Sure, I'd like to know more about the PDM program.
So notice as soon as PDM was mentioned, Ambient Intelligent Hub is constantly listening and suggests to the agent, hey, maybe you should talk about this. Here's the information. So you don't have to spend time as an agent looking up the pertinent information, and you get that right in your fingertips right here. And then you can use that to tailor the conversation that you're having with your member.
Chris, PDM offers extra support with your recovery. Through this program, we can help you manage your health concerns and assist you in reaching your goals. This program gives you access to a 24-hour nurse helpline, and you'll receive these benefits for free. And anything you share through this program will not affect your health coverage or benefits. Also, this is voluntary. You can opt out at any time. Would you be interested in enrolling in the program?
I don't know. I don't completely understand how this would help me. I'm also scared that any activity would exacerbate my knee.
I understand. Please know that knee surgery is a very common procedure, and there are almost no complications as long as you take your medication and stick with your physical therapy.
That's good to hear. I wanted to learn more about knee surgery, and it is very frustrating that there isn't a lot of information available online.
So two things here, right? One, he wanted to learn more about knee surgery, and you have a pop-up about knee surgery that Tony, the clinician, can now provide. But second, notice the emoticons in the middle. You're able to analyze the sentiment, and AIH is also enabled to detect if there is a frustration detected within a member, and perhaps you should show some empathy here. Perhaps you tailor around your next conversation.
Chris, I get your concern. We actually have an educational video that gives you more information about your procedure and what to expect. I can share the material with you so you can go through it. How does that sound?
Yeah, that sounds great. Can you share it with me by email?
Definitely, Chris. Just to verify your email, it is chris@gmail.com.
That is my email address.
Great, thanks. Let me send the video to you now.
So AIH is able to detect the intent of the task and also send an email on behalf of Tony to Chris.
Chris, you should be getting the email soon. Have you received any post-discharge instructions from your physician? Especially those regarding rehabilitation, medication, and follow-up appointments.
Yes, I did. I'm trying to figure out my medication based on the information provided.
Okay, based on those instructions, do you know what drugs you need to take?
Yes, I have been prescribed Advil 600 milligrams to be taken every 6 hours.
All right. I would like to provide you a disclaimer on that. Not to double dose on any medication if you missed it once. Please restrict yourself to a single dose within a 6-hour interval as prescribed by your physician.
Okay.
Have you made any follow-up appointments with your doctor?
Yes, I've got a follow-up on the 24th of November.
Okay, great. What time is that appointment?
It is at 11:30 a.m.
Okay, thank you. I will remind you before the 24th of November about your appointment, and we can connect after your appointment to follow up on next steps.
Okay, that sounds great. Thank you.
Would that be all for you?
Yes, and thanks for all your help.
Great. Have a nice day.
All right, so that's the demo. So notice the little things, the little admin task that AIH was able to automate for this clinician, right? And towards the end, you also have a post-call summary, right? This not only captures the entire transcription, but it also then picks out the most important points of that conversation. Because this conversation could be 10, 20 minutes, right? You don't want just a rough transcription of every single word that has been spoken. You want to know what were the key insights, what were the outcomes, what was the issue, and what were the action items, right? In this case, we wanted to check on the health of the patient, how are they doing, right? We wanted to follow up on their medication, have they received it, do they know enough information about it, how often to take it. We also wanted to enter the medication information and their follow-up information in the CRM systems that we have, and we were able to do that. That will allow us now to follow up with them, make sure that they are going to their appointments, that they're adhering to the course that has been assigned to them, right? And that's kind of leading them towards a better recovery after the surgery they've gotten, right? So this is just a sneak preview of what this platform can do. Just to kind of summarize, now we are able to focus on meaningful conversations, right, from an initial perspective. We are able to automate capturing of critical notes during the call, and we are able to trigger workflows that are specific, that are relevant to that case, right? And we can also auto-summarize the next steps. So we started this session with Katie and Katie's journey and her frustration. Now look at what happens with this platform. Meet the happier Katie, right? And see how her life has been changed, digitally delivered, personalized, and humanized. So she gets the news. She also gets a text before the surgery, letting her know that she has a surgery coming up. If she needs help in picking up or booking an appointment or getting there with a car or a taxi cab, we can help her there. Humanize engagement in moments that matter, so she is empowered that she has the options to pick the surgeon, to pick the timing, to know more about the surgeon and the practices they follow. As she's undergoing the surgery, she also gets text messages from the clinician that good luck, and you're going to be getting more information after the surgery. We are here with you, right? So this really just reaffirms the notion that you're not alone in this journey. This is a real concern, right? This is a real problem we're trying to solve. And finally, because we are able to do all of these things, now when the outreach happens, it's not out of the blue, right? Now there is a relationship that we are able to build. So we are able to proactively volunteer her to support with the programs that we have, help her with her appointments, any kind of physical therapies, any kind of prescription management, right? Katie agrees to enroll to the care management programs that we have. And all of these things, they result in increasing and building the trust that we need to have between our clinicians and our patients, right? So this is the kind of impact we are able to make. So as I mentioned, I am extremely excited about the promise of Ambient Intelligent Program, Intelligent Hub, and the things that we can do here. And it's an impact that we are already noticing in terms of the results. But to talk more about the work we have been doing and the impact that we have been making, let me invite back Geeta.
You bet. So what you saw is some level of personalization, right? Using information that we know about them, not just their medical condition, but who they are as a person. And that takes some behavioral science. You saw also ambient intelligence, which takes the opportunity to understand, we call it Netflix for health, right? The ability to intercept and have workflow, guided workflow, knowledge management, all coming in at points. And then you saw operational intelligence. And this is important because we're not just here. While I want to make the experience better, number one. Number two, I want to make it simpler, faster, easier, right? Number three, I also need to reduce down my cost. I cannot continue with the cost structure. It's unsustainable. Look at some of the contribution that I started with earlier around healthcare costs and being unsustainable. It starts also with our organization. How did this all start? It started unbelievably with a conversation with our chief operations officer in the clinicians from my clinical team, Dr. Anthony Nguyen. And he said, I need to make my nurses more effective. I need to have them engaging with their members, but I also can't do it at the same pace with just adding more bodies. That's important to note for me as a technology partner. How do I do it? And it started with a conversation that we had around replacing telephony. What you saw was an amalgamation of different types of technology that had to come together to orchestrate the experience. What you saw was not vaporware. We actually have it in our systems. We actually have it where these outreaches are going out. And it's about a year into this journey. Now we're building all the foundational architecture and infrastructure so that we can do this more at scale with our individuals. When we do that more at scale, we're going to impact metrics like have people who are more engaged, right? Less member engagement costs. We're going to increase our turnaround times. And for me, I think it's important, I have a heart for our consumers and our associates too, making their lives easier. And you saw as the conversation was taking place, things were coming in that they ordinarily would have to click on to find that information. Instead, because of a trigger that I can now actualize for the Ambient Intelligent Hub, using AWS technology, I can serve that information up. The other beautiful thing is that this is called, there's a thing called medical comprehend, which takes information that is medically derived or health information and makes sense of it. And it's built into the stack. So foundationally, I had to look, and our team had to look as technologists, how do we not have 500 different solutions, but capabilities that work easier together, that get us to the outcomes that we need. So when I go back to Anthony, and me and Anthony talk every day, Dr. Anthony, and he'll also call my team members up and say, hey, are we ready for the next experience that we've got to pull in? When I talk with him, he sees things moving faster, and he also sees results, because he has to also optimize his operations. So I serve as a business partner also to those operations. And for me, it's really important that we choose the right technology, but also choose the right partners that we can accelerate our journey with. And so it's been really good to partner with our team over here, with Mohit and Gary, and the respective teams that we all work with, to accelerate this technology. So you've seen a slice of it, by no means all of it, but we hope that you got something from this presentation, and we're open up to questions.